Thank you, everybody, for attending today. I'd say it's good to see you, but I can't see you, but it's lovely to have you all here. So welcome to this inaugural professorial lecture. My name is Marcus Bhargava, and I am the head of School of Education, Midwifery and Social Work here in our joint faculty of Kingston and St George's. It is my great pleasure this afternoon to introduce Professor Rick Hood this afternoon. We'll be hearing from him in a moment. Before I do the formal introduction, Dean Andy Kent, who unfortunately cannot be here today, has recorded a short video which we're going to share for you now. Over to you, Anastasia.
Hello everyone, my name is Andy Kenz. I'm Dean of the Faculty of Health, Social Care and Education. I'm really sorry I can't be with this evening. I have a prior personal commitment that's taken me away from the university. I'm very grateful to my colleague Marcus Bhargava, head of the School of Education, Midwifery and Social Work, for introducing Rick to you. Rick, if I can say a few personal words about you and to you, you're an outstanding colleague with a stellar track record in research. In the 6 or more years that I've been on the Professorial Appointments Committee at Kingston University, yours was by far one of the easiest promotions to make. Your work is of international importance and international reach, and you manage to, in spite of the enormous burden of work that work requires, to be a terrific colleague and to contribute to both teaching and university life in general. And it was this good citizenship, in addition to your outstanding research contribution, that made it so easy for the panel to recommend you for promotion. Your references were all glowing, and you have a glittering professorial career in front of you. Thank you again for all the work you do for us. Make us proud now and make us proud in the future, as I know you will. And all the best, and see you when I return to university next week. Thank you.
Thank you, Andy. So, Professor Hood qualified as a social worker in 2007, having spent several years working in youth and community engagement in London, France, and Germany. His social work was focused around child protection and looked after children teams. He completed his doctorate in 2013 on complexity and interprofessional working in children's services, and began to combine his social work with part-time work in academia before joining the School of Social Work here, full-time in 2015. Professor Hood's research inhabits the highly contested, politicized, and policy-driven space of modern social work. One of his great skills has been to make research of British social work theory and practice highly relevant to an international audience of stakeholders, including fellow academics, practitioners, and policymakers. He has made significant contributions in 3 main areas. The first of these is the application of complex systems ideas to social work. His doctoral work on complexity and interprofessional working in children's services sought to apply complexity theory to the challenging practice environment of child protection work. His findings created a conceptual framework for ongoing study and informed an important and widely read textbook, Complexity and Social Work. This book was published by Sage in 2018 and explores key practice issues such as needs assessment, decision-making, and relationship building through the lens of complexity, as well as investigating the role of complex systems in relation to policy, research, and management. The second area is the analysis of demand for children's welfare services. His early findings led to a successful external grant application, and the Department for Education have taken a keen interest in his work. He has extended this work in recent years to adult services in a range of people-centered settings. Professor Hood is regularly invited to present research findings to policymakers, managers, and practitioners, as well as academic conferences and seminars. He has contributed 2 evidence reviews to the independent review of children's social care this year, one on decision making and another on reunification from care. The third area is research into welfare inequalities. Over the past 3 years, his research funded by the Nuffield Foundation has explored the link between system conditions and welfare inequalities in children's social work, children's social care, looking in detail at how the structure and organisation of services contributes to the emergence of inequities in provision. This work also included a detailed analysis of the social gradient in children's social care using the national data sets for England and a study of reunification and re-entry to care. All 3 of these areas are united in advancing social work policy and practice, and fundamentally in improving the lives of vulnerable adults and children. The importance of this work has yet again been tragically illustrated by recent events in the news. In addition to being an outstanding qualitative and quantitative research professor with a huge real-world impact, Professor Hood has made vital contributions to the development of a research culture within the Department of Social Work, our school, and the wider faculty. He also made important strategic contributions to knowledge transfer, developing key partnerships outside of the university to advance knowledge and practice. Professor Hood believes that research, teaching, and scholarship can make a difference to people's lives, and is driven by the desire to promote systems thinking in social care policy, management, and practice, so that our services can shed their bureaucratic constraints and harness the potential offered by human relationships and capabilities. Professor Hood is a terrific teacher and a great colleague. We recognise how lucky we are to have him here. It is with great pride that I introduce him to you. Following his lecture, Dr. Wilson Malaya, Head of Department of Social Work and Social Care, will give the vote of thanks. And just finally to say that questions are not usually asked in these lectures, but obviously normally if we were in person, you might be able to speak socially with Rick afterwards. So with his kind permission, what we'll do is after the vote of thanks, we'll keep the we'll kind of keep the screen on, and Rick might be able to take some of your look at some of your comments in the chat and answer any informal questions you might have at that time. With great pleasure, I introduce Professor Rick Hood.
Thank you very much, Marcus, for that introduction, and to Andy as well, the Dean of Faculty in his absence, for his kind words. Has a lot to live up to there. And thank you everyone for making time to come and listen to the lecture this afternoon. I really appreciate it as always. Just before I say a few words about the topic, I aim to speak for about 45 or 50 minutes, I think, and then, as Marcus said, it would be good to have a quarter of an hour or so just to discuss some of the issues. Hopefully this is a topic, regardless of what I present, that people will have views and opinions on, and that's partly why I've chosen it. So prevention. So because it's my inaugural lecture, it's apparently I can talk about anything I want to, as long as it's relevant to the research I've done. And I suppose prevention is a theme, an underlying theme in a lot of the research that I, along with other colleagues working in this area, have been doing over the last few years. It's also close to my heart because before I became a social worker, as Marcus mentioned, I did youth and community work in various places, and saw for myself the difference that those kind of services can make. You know, often quite unheralded, small scale, really embedded in communities. And I'm talking about things like youth clubs, youth services, family support services, local charities, often existing from year to year on the most minimal of grants. And the difference that they make to their communities is tremendous, and the loss that's felt when they're no longer around is also tremendous. So it's something that I've always kept in mind, even afterwards when I became a social worker and became more involved in the the statutory intervention side of things. The other reason why it's good to talk about prevention this week is because of awful events that have been reported in the media, and there are two main news stories that dominate the media this week. One is something that has become pervasively familiar to us, which is the pandemic, the COVID-19 pandemic, which is not over; it's still here. And among all the things that COVID has brought to us in the way of catastrophe over the past 2 years, it's shed a light on social inequalities. Because although it's an experience that we've all shared, there are parts of the population that have suffered disproportionately under COVID-19. And that not only reflects inequalities that were there before the pandemic, but has also widened them if you think about the economic and the health consequences. And that's one aspect of prevention. If you like, that's one side of prevention. The idea that it is about social inequality, and you can't talk about preventative services without thinking about social inequality. And then, of course, the other main news story this week has been the awful killing, the murder of a 6-year-old boy, Arthur Labinger Hughes, by the people who are meant to be caring for him. And this obviously raises another huge question about prevention, which is, how do you prevent this happening? How do you help the services and the people in the children's workforce that are engaged every day with trying to make sure that children are safe and supported and thriving in their families, to identify those children that are most in need of help and most at risk of harm. And this idea that there are many different aspects to and types of prevention, I think, is fundamental to how we frame and discuss this topic and build a case for change. So what I want to do in this lecture is, and you'll forgive me hopefully if some of the material I present is skewed a little bit towards the work that I've done and that colleagues have done that I work with a lot, because obviously there are many people whose work I could cite in relation to prevention and preventative services. So it is geared towards what I've done, and I hope that's understandable in this case. What I want to do is give a bit of background as to why I think it's important to talk about this, define as best I can what I mean by prevention, while acknowledging that others may understand and define it differently, and then present a case. So what I want to do first is say why we need a case for prevention, as obvious as it may seem, and then present that case from an ethical standpoint, from an economic standpoint, and also the political case that needs to be made. And then I'll finish by pointing to some ways ahead, which is not it's not designed to be a manifesto for government policy. It's more reflecting on the evidence that I and others have collected during the course of our work, and what pointers that evidence gives to what might help in terms of making our child welfare system more preventative. So just to start with the obvious, it's a slogan really now, isn't it? Or it can be used as a preventative slogan. Prevention is better than cure, attributed to Erasmus. And it's fair to say that it's a truism, because everyone can understand what it means and relate to it in a common sense way. That is, in health terms, it's obviously better if people live healthier lives. The social conditions that improve health mean that then therefore there's less need for people to be admitted to hospital with acute and chronic health conditions. Everyone understands this, and everyone can buy into it, no matter what political persuasion they are. That's what makes it so effective as a slogan. But like all slogans, it has its defects. It can be applied in a too superficial a way, because while prevention is easily understood, it's very, very difficult, as it turns out, to implement and apply, and nowhere more so, I would argue, than in the field of child welfare. So it's in the nature of academic presentations to make simple things more complicated, and this presentation will be no exception, but hopefully in a good way. You start off with the slogan, and then you dig into it and see actually How can this be made a reality? And although there's a clear public health message to the idea of prevention, we're talking about it now considering it in relation to a specific area, which is that of child welfare, or what might broadly be called child safeguarding. And safeguarding is, of course, about protecting children from harm and about identifying the children who are most at risk of poor outcomes in later life. But it is also safeguarding about ensuring that children and families have what they need, the resources that they need and the support they need to thrive, and for communities to flourish and create the best possible chance for all children, regardless of their background and characteristics. Now, because safeguarding is a spectrum in that sense, you can look at prevention at different points on that spectrum. So, of course, the usual way you understand it, and the way that I'm going to understand it in this lecture, is the resources, support, and help that children and families need in order to thrive and lead a good life, as it were, and so as to give them the best possible chance, give us the best possible chance of heading off the occurrence of abuse, maltreatment, and the things that make it less likely that children will thrive during the course of their life. You can also look at prevention that refers to services that happen after maltreatment has occurred, and which try to work with children, with families and parents to stop it happening again, address the underlying reasons why the maltreatment has happened. And if that's unsuccessful, then you can also regard services that work with children who, for example, cannot live with their birth parents, to ensure that they put in place the building blocks of resilience so that they can be have the best chance possible of leading thriving in later life, despite the adversities that they've encountered earlier in childhood. So you might call that the prevention of impairment. All of these are valid ways to look at prevention, but what I'm concerned with this afternoon is this: prevention before occurrence, particularly around universal services, which are open access and freely available to all families and children, as well as some targeted services that focus on the particular issues that families need help with in order to live a good life. I want as well, because there's lots of, well, hopefully lots of social workers listening this afternoon, to just quickly present this diagram. So this is something I put in my book on complexity, and it's designed to look at needs assessment in social work. And the point I was trying to make with this is that there are often social workers in statutory services are often involved with families at a point of crisis. So problems have come to a head, and they really need help, often from a variety of people, to get over that crisis and deal with its causes. And the scope of analysis in needs assessment therefore tends to focus on what you might call proximal causes. So these are the arrows labelled C and D in that diagram, that often are individual in nature, or look at the immediate family context. So that might be an abusive and violent relationship, for example, or it might be an episode of postnatal depression, but it can be clearly and in terms of time quite immediately linked to the crisis that's occurred. However, social workers are trained to examine factors that are more than just about the individual and about the immediate family context. So we know that wider social structures and problems in the social environment are also relevant to why families experience problems and periodically come into crisis at different times. And that's what's meant by the arrows that are a bit longer, longer in time, the A arrow and the B arrow. And this might be, for example, problems in neighbourhoods, such as high levels of crime, unemployment, young people with poor prospects. It might be about high levels of poverty and deprivation. It might be about gang activity. It might be about housing, about scarcity of decent and affordable social housing, problems with landlords evicting tenants for complaining. It might be a whole host of things that actually create the conditions in which families are much more likely to experience crisis or enter into those kind of dynamics that are associated with risks to children, including violence, substance misuse, and mental health problems, of course. So the reason for taking a bit of time to explain that is that I think that's where the zone of prevention comes in, because for me, prevention cannot just be about individual casework. It does involve that, of course, but it can't just be about that, because prevention has to encompass some of those wider social and collective issues, particularly where they're occurring in particular local contexts. And that's going to be something I'll come back to at various points during the lecture. And so, for example, if you, in your local authority are working with families that are continually coming from the same part of town or the same part of the county, where they seem to share certain social problems they have in common, whether that's housing or whether that's a problem with alcohol misuse or whether that's a problem with being unprepared for parenthood for whatever reason, then you have got a social problem that you are dealing with at the same time as you are working with people on an individual level. And it's this zone, this preventative zone, where we have a lot of problems with, in my view, in the child welfare system, and more to say about that in a short while. Worth noting, of course, as well, that there are general large-scale social problems that affect everybody, such as the general level of unemployment in the society, or the existence of high levels of food poverty, of unemployment and precarious unemployment, or a housing shortage and the scarcity of public housing. All these do require national strategies and intervention from the national government. So at the same time, it's possible to say there are certain things that lie outside of the aegis of local agencies to work on their own. They need the help of the national government for that. So I think so this is why prevention is difficult, because you have to combine the collective with the individual. You have to acknowledge the structural as well as the importance of people's choices and their autonomy, and you have to have a strategy for somehow doing what you can to intervene in that zone. Now, this is nothing new, of course, in what I'm saying. There's been a long-standing debate in children's services that probably goes back further than I've been alive, but certainly has been around as long as for the past 30 years since implementation of the Children Act, about rebalancing children's services. And the idea of rebalancing, of course, the image there is a kind of seesaw. It's a dichotomy between prevention on the one hand, protection on the other. It's a particular characteristic of children's social care, I think, that you don't really get so much with health, for example. So no one regards it as incompatible to want to improve hospital care at the same time as have public health interventions that mean people in general lead healthier lives. But as we'll see, in children's social care, that framing really does become problematic. So you can see it as a dichotomy, prevention versus protection. Which do we want to do? What kind of money do we want to spend and where on? Or you can see it as a spectrum. But it's been long observed that it seems there is a tendency for resources, expertise and money to accumulate around the protection side, and for then the prevention side to be under-resourced and under-invested in. And hence the need to rebalance. This has been acknowledged by the independent review of children's social care that's going on at the moment. They published a case for change earlier this year that acknowledged the need for more support for families, acknowledged the fact that there were a lot of investigations and high numbers of children in care, and that there was a case to be made for rebalancing the weight of interventions in the child welfare system, at the same time as making sure that risk assessments and decision making were being done properly, as it were. Now, a lot of the work that we've done in recent years is focused on inequalities, and I'll say more about that shortly. There is what's called a very steep social gradient in child welfare intervention. And what that means is that in areas, whether that's small neighbourhoods or local authority level, the more deprivation you have, the more referrals to children's social care, and the more demand for child welfare interventions. So inequality, as I said at the start, inequality itself points to the need for preventative services. And then finally, as I've said, the impact of COVID-19 has reflected social inequalities in terms of who has disproportionately borne the consequences of severe illness, death and disease, but then also in terms of the aftermath. If you think about, who is more likely to be, materially disadvantaged after the furlough payments get withdrawn, who's more likely to have lost their jobs, which families and which communities have suffered and will suffer more as the consequences of the pandemic become more apparent over the next few years. We don't know yet, of course, because it's still ongoing, but it's likely to widen social inequalities. And again, that puts the focus on what can we do, what can we put into communities and into universal services to try and stem the tide, if that's what's going to happen, of escalating need, potentially overwhelming social care services in the future. And I think most people would agree that those things are worth thinking about and actually are common sense in many ways. Yet there's a constant tendency for the obviousness of the case for prevention to be not backed up in terms of the actions that are taken and the policies that are actually implemented. And Kearney and St Denis, for example, in their book, talking about the prevention puzzle, and they point out that governments of all stripes often come to office promising similar things. They promise to shift the balance in health and social care policy from expensive acute care to preventative services and early intervention. They say they're going to join up policies and link policies to programme deliveries and make sure everything is evidence-based, and that the focus from now on will be on long-term outcomes, not short-term fixes. So lots of governments say this when they're talking about their social policy, and then it gets really hard, and the complexity of the terrain begins to make its effects felt, and you get a lot of disillusionment and exhaustion until the next government comes along and promises to do something about it. And so they don't say that all prevention policies fail, but they say there's this consistent gap between expectations and outcomes in prevention policy. And I would argue that gap is particularly wide in child welfare, in the field of child welfare. Over the last few years, we've done a lot of research into the children's social care system. So taking a systems perspective to look at what's happening in children's social care in terms of trends and also associations between different types of demand and provision. There's been increasing concerns over the past decade. There's been a steady shift to what's called late intervention. So, for example, if a referral comes in today to children's social care, it's much more likely to result in a child protection investigation or a child protection plan than it was 10 years ago. A lot of this has been driven by cuts to local government budgets. On average, 60% has been taken out of local authority budgets over the last 10 years. And those cuts have been felt disproportionately in deprived areas. And that's partly because of changes to the funding formula that were implemented in 2012, which disadvantages the most deprived areas. And so you've got the need for local authorities to protect core statutory services. They have to do that. You also got the need to deal with rising numbers of children in care. So numbers of children looked after by the state have increased by nearly a quarter over the last 10 years, over 80,000 in 2020. And that includes a sharp rise in the number of teenagers being taken into care, who often have more complex needs than younger children. And so these children require a lot of help, a lot of support, and it's becoming financially unsustainable for local authorities to provide it. So there's a concern that there's a vicious circle. So you have to ration what you don't have to pay for, and unfortunately that means preventative services, youth services and services in the community, and then there's nothing trying to stem the tide of spiralling demand. Added to that is the impact of deaths from child abuse, which is a kind of a ratchet that occurs periodically in response to the tragedy of child deaths, the most extreme form of child maltreatment. And and sadly we see this having happened again this week, and it inevitably puts focus on decision making, on investigation, and on an intervention. And the other crazy thing about this is that it creates this wedge between prevention and protection, which I was referring to before. So you have this assumption that an emphasis on addressing the drivers of demand for children's social care and providing help and support to families is somehow synonymous with a permissive attitude towards potential abuse and neglect. Which obviously, if you talk to any social workers, that's ridiculous. And in fact, if social workers had more time and more resources and more capacity to spend on thinking about those children where you do need to talk to more people, find out more, go back to the office, talk to your manager, talk to your colleagues, and really establish what's going on in that family. Preventative and effective preventative system actually would improve that. Yet for some reason in our political culture, it's seen as somehow inimical. And if you take a wider perspective, in sociological terms, we have an increasing distance from this idea that private problems are related to public problems. So we over the decades have increasingly become used to the idea that individuals are responsible for their own destinies. And it's this enterprise of the self, which sociologists of modernity will talk about. And that makes it harder, for example, for addressing some of the structural issues that create. In addition to that, there's something called the Developmental Origins of Health and Disease, which is a set of ideas that suggest harmful exposures occurring early in life will increase the risk of disease and poorer outcomes in later life. And that sometimes these risks carry over into future generations. It's a fairly exploratory and fairly controversial area of primary research, looking at things like neuroscience and epigenetics, and yet it's been hugely influential on child protection, hugely influential. For example, one of the ways in which it's been influential has been this idea that neglect, the experience of neglect, will damage the brains of very young children, causing irreparable damage, and that this then leads to a policy focus on intervening as early as possible in children's lives where there are concerns about neglect. Of course, this when you actually dig into the evidence and the data on this, it's much more shaky than it looks. Another characteristic of this set of ideas, when it's translated into policy ideas, is the idea that parents who are living unhealthy lifestyles or are making poor choices are likely to damage the prospects of their children even when they're developing in the womb. And this, again creates this policy emphasis on intervention before even a child is born, and very much putting the emphasis on identifying mothers in particular, and identifying parents who may pose a risk to their children. This is very troubling in certain respects, not because of the emphasis on identifying risks, but because none of it is based actually on sound evidence when you dig into it. And so I do recommend the writing of David Westphal and Sue White on this. I mention it also because it seems to feed into this preoccupation that's developing with predictive analytics and machine learning, using data to identify and target individuals needing intervention. I think it's the wrong way to go, mainly because, well, researchers use data to look at demand and provision all the time. But generally, it's to look at inequalities and risk factors that are historical. What predictive analytics does is turn that around on its head and introduce all those biases into the prediction of who you're going to target next. So this again is a different kind of prevention. So I would argue it distorts the idea of prevention and turns it into something called early intervention, where early is ambiguous about whether you mean early in the onset of problems or early in a child's life, or even in the unborn child's life. So my view on prevention is that there needs to be a case for it, certain kinds of prevention. A prevention that is services that are designed to help family early in the onset of problems. Services that provide the help that families want. So clearly all families will be unique and have their different problems that they come to services with. But there's a lot of contextual demand around what families present with. There is a need to understand and listen to people in order to find out what matters to them, and that means that the services need to be co-produced with families and communities. So if in part what I'm advocating is putting back into communities and services what's been taken out of them for the next 10 years, it doesn't mean they have to look exactly the same. Families will tell you, if you take the trouble to ask them, what would help them in terms of their lives. And that's one way in tandem with a national strategy to deal with poverty, racism, discrimination and exclusion, which do require national action. All those things have local manifestations. The aim of prevention is to reduce demand. Well, I mean, you said the aim is to make sure children thrive within happy families and in flourishing communities. And in the process, that will reduce demand across a range of agencies. And that requires investment. It requires reinvestment in services that have been decimated over the past decade. So you have to make a case for this, because what we know is that the Treasury, which holds the key to, unfortunately, a lot of things in the centralised political culture of England, is very loath to countenance the idea that the problems that are being experienced in child welfare, such as rising rates of children admitted to care, have to do with austerity and cuts. Rather than, for example, poor decisions being made by social workers or services that are not doing what they should be doing with the money that they already have. So you have to make a case for it. The first case to make is ethical. In some ways, the easiest case to make. There's a clear children's rights rationale for an argument for prevention. The United Nations Convention on the Rights of the Child requires states to provide appropriate support to parents, in particular to prevent children being deprived of parental care. And there is guidance associated with that that actually talks about what that means in terms of a comprehensive child welfare system. So policies to support families and address the root causes of child protection interventions and children being admitted into care. And the guidance also states that material and financial poverty should never be the only justification for removing a child, but should be seen as a signal for the need to provide appropriate support to the family. Now, of course, no child is subject to a child protection plan or admitted into care just because of poverty. I'm pretty confident that doesn't happen. However, it is not possible to argue, I don't think, that poverty has nothing to do with maltreatment, and that we have too many children living in poverty in this country. So if poverty is a signal we need to do something about it, then where is the action? The link between poverty and neglect has been particularly exhaustively studied, and there's a lot of evidence for it. That is not to say that all parents who live in poverty neglect their children, because clearly the majority do not. However, poverty creates conditions in which maltreatment is more likely. So if we want less maltreatment, one of the main things we could do is have less poverty. Even if you look at the most basic kind of poverty, food poverty, there's a huge amount of it in this country now. There was a House of Commons report on it this year, which cited the Family Resources Survey, showing that in 2019 to 20, 5 million people, so that's 8% of the population, were in food insecure households. Among those in relative poverty, 19% were in food insecure households, including 26%, over a quarter of children. So there's a huge amount of food poverty. There aren't official statistics on food banks, but we know there's 1,300 Trussell Trust food banks operating in the UK last year, and over 1,000 independent food aid networks, food banks in the UK. And the Trussell Trust alone supplied, more than 2.5 million 3-day emergency food parcels last year. About 40% of those are going to children. So there's a huge amount of basic poverty that is impacting on children's lives. And at the same time, as we know, there is a very steep social gradient in terms of the effect of deprivation on the chances and the likelihood of having a child welfare intervention. So this is the only graph in the presentation, I promise. But this is from our recent study of the national data sets for children in need. Each of the dots in that scatter plot represents a small neighbourhood in England. There are over 32,000 small neighbourhoods in England, each of which has a particular rate of income deprivation, and each of which has a particular rate of referral to children's social care. And as you can see from the best fit line, there's a clear association. In an averagely deprived local authority in England, every 10% increase in the level of neighbourhood income deprivation in that local authority can be expected to produce a 62% increase in the rates of referral to children's social care. And if you're talking about child protection plans, every 10% increase in deprivation leads to an 80% increase in the rates of child protection plans. Very, very steep. That social gradient and the steepness of it varies systematically between local authorities. So if you're living in a very deprived local authority, relatively speaking, like Blackpool, the social gradient is lower. If you're living in a less deprived local authority like Kingston, where I live now, the social gradient is higher. So more affluent, less deprived local authorities intervene more disproportionately in the lives of poorer children living in those areas. Social gradient is steeper in rural areas compared to urban areas. Social gradient is steeper for younger children. It is steeper for children who are on child protection plans, and steepest of all for children who are assessed in relation to neglect. Disproportionate focus on children from deprived backgrounds is embedded in the way we currently do things in children's social care. There are huge collateral consequences to that. If you want to talk about feedback loops, Broadhurst and Mason, they did a piece of analysis drawing on the rehabilitation literature in criminal justice, and they explored the consequences of court-ordered removal on both parents and the wider family, and things like grief, guilt, isolation, stigma and loss, as well as other penalties such as loss of welfare and housing entitlements. It has a huge impact, which then, of course, has a bearing on repeated admissions to care and parents who have further children and then find those children as well admitted to care as well. The final ethical issue, I think, is, we need to remember that these services and the systems that we have in this country that are backed by the state, there needs to be a social consensus around it. We we take it for granted that social workers have the the right to do what they do, but at its heart, that there needs to be public acceptance that is the right thing to do. So there is an ethical obligation, I think, to understand what matters to families and what they need services to be like to help. Now, one final point about this diagram. When I show this in webinars, I think some people it's like I'm stating the obvious. It's a fact of life that as deprivation increases, child welfare interventions increase. I don't think it should be regarded as a fact of life because the costs involved are so huge. When you look at that steep line and think how steep it is in certain places. And part of that cost is financial, of course, because these services are very expensive. And when we've been looking at the system effects within children's social care, we've discovered quite a few pretty basic feedback loops. For example, if high deprivation authorities have a lot of referrals, they have a lot of demand, they have a lot of everything. And local authorities that have a lot of demand also screen out more cases out the front door. They do more screening, they filter out more work. That is an association that you find consistently across years. And local authorities those local authorities, they screen out work at the point of referral and assessment, and they also work for shorter periods of time with children that do get a service. And local authorities that do manage demand in that way, that do a lot of screening out, they tend to get a lot of re-referrals. They get more re-referrals within 12 months. So that work comes back. So that's one of the feedback loops that you could term rationing or screening. Partly as a result of that, of these kind of feedback loops, early help services. So that's the type of prevention that is integrated now into children's social care, have adjusted to increasing complexity of need by becoming more targeted. Sort of early help services now, they operate just underneath thresholds for statutory intervention, and they do targeted casework with individual families aimed at stopping them from coming into the system. And in a way, this reduces their ability to operate preventatively because they begin to adopt the characteristics of the statutory service. They have threshold criteria, they have referrals, they assess need, and then deliver a targeted intervention with the aim of closing that case. And it's with individual families. And the result of this is obviously it acts as a buffer. It acts as a buffer. But eventually, if you are operating preventatively, you will get escalating demand for those expensive late interventions. When that results in rising levels of admission to care, you get a lot of cost associated with it. Now, one of the ways you can look at this is through a concept of failure demand, which is coined by John Seddon, who's a writer on management and systems. So failure demand, from Seddon's point of view, is demand that you get because you haven't done something, for the person that's receiving that service. You haven't met their need, you haven't addressed what they come to you for, so they come back into the system, because you haven't got it right. And if you look at transactional services such as council tax benefits or housing repairs, you find up to 75, even 80% of demand is actually failure demand. And if you redesign services so that people get what they need quickly and don't come back, then you actually free up a lot of capacity because that demand isn't there anymore. And when it comes to people-centered services such as social care, it's obviously trickier because everyone's different with what they want. But if you design services so that you quickly understand what it is that really would help, and then the resources that they need, then you're in with a chance of reducing demand and stopping that escalating spiral. Now, my colleague Callum Webb at Sheffield University, really worth reading his stuff. He's done a lot of work on spending and the impact of changes in expenditure over the last decade. He found evidence that before 2015, local authorities that spent more on preventative support saw a significant decrease in sin rates the following year. But then what he also found was that after 2015, that association stopped becoming significant. So what he's basically saying is that, you know, spending more on early help really used to work and used to, reduce demand for statutory services, but you can't be sure of that anymore. And again, he attributes this to the tendency for early help now to focus on more and more complex cases of need. So it's effectively just becoming another layer of statutory intervention. There's another recent paper by Devara Bennett from Liverpool, who looked at the effect of changes in preventative spend on rates of entry to care. And again, found that, well, there wasn't a significant association for younger children, for under 5s, but on average, local authorities that spent more on preventative services for older children, for adolescents, were able to see a decrease of 1.9 per 10,000 children aged 16 to 17 entering care the following year. So again, spending more on preventative services for adolescents was found to affect care entry the following year. Of course, you don't need that big an effect to see quite substantial cost savings if that's what you're looking for. In general, there's a bit of a literature on how to do economic modelling of social return on investment for preventative services, and some of that literature is summarised by Andy Bilson and colleagues in their report Childonomics, and they also discuss various international examples of policies around prevention and early intervention, and how that's been studied in terms of the return on investment. And this has to be seen in the context of the social and financial, the social cost for each child that needs a social worker. So again, the Independent Review for Children's Social Care has done this analysis pretty recently, and their figures show that the social cost for each child that needs a social worker is £14,000 a year, and up to £720,000 over their lifetime. And if you applied this figure to all everyone that's needed a social worker who's alive today, adds up to £23 billion a year, which they point out is 1.5 times the Home Office budget. And current annual expenditure on children's social care and associated services is just over £13 billion a year of the money that's being spent, and the potential scope to make an economic case for investing billions of pounds, I would argue, in preventative, universal and targeted services over the next decade. So it's easy for me to say that, but I'm not a politician. And actually it's the politics of it that's where these things often kind of founder. Again, returning to Kearney and St Denis, the point they make is really worth bearing in mind, that the case for prevention, it may be superficially easy in political terms to make, in terms of that prevention is better than cure type slogan, but quickly runs into complexity. So it's the ultimate wicked problem, is how they describe it. And partly this is about limited control. And we have such a centralised political culture in this country, such an assumption that in Whitehall, the levers of power can just be operated in such a way as to control everything in the whole country. The whole debate around accountability assumes that ministers can actually point their fingers and direct things in over this enormously complex policy domain. It's simply not true. No one has that amount of control over this kind of arena, and so the reality is that such policy making is it's multi-centric. It does involve devolving down to the local level. It involves trying things and studying the data and working quite closely with the people who actually understand the realities on the ground. All things we're terrible at the moment in this country. The other big issue with making a political case at the moment is the really strange silence around austerity. Ray Jones, who was talking sense as usual about you know, what we should be doing in relation to the concerns about services after the death of Arthur Labanjo Hughes. Described it as the elephant in the room, because none of the you know, not only government politicians but also opposition spokesmen would talk about it. And yet the backdrop of savage cuts to preventative services over the past 10 years are surely part of the picture when you're thinking about what could be done to make child welfare services more effective and successful in the future. So there's a need to drag it back into the room, or to at least paint it in a colour that people will recognise. And you know, it's very disappointing. I challenge anyone to look at all the documents that the Independent Review of Social Care has got on their website in relation to all the work they're doing, and find the word austerity mentioned even once. I don't think it will be, because there's been a conscious decision not to talk about it as a way of ensuring that the recommendations are heard and may be acted on by government. It makes superficial sense, that kind of strategy, but actually it's just shooting ourselves massively in the foot. Because that is a nettle that needs to be grasped. You know, the case has to be made. So we need help with finding alternative frames for this. Sadly and unfortunately, the dominant framing in children's social care, which is around child rescue, should be helpful to make the case for austerity, but for investment in prevention, but it doesn't. Instead, it quickly becomes a stick to beat people with, in the sense that investing in prevention is seen as detracting from the importance of identifying significant harm. So we need other frames, and I think social work academics particularly need help with this. There may even be an opportunity to use some of the government's own rhetoric around issues such as levelling up and building back fairer, to use some of the policy discourses that actually are considered important, you know, for parties' electoral chances, as a way of creating that shift, you know, towards these things being in society's best interests, rather than the, I suppose, politicised discourse that develops around prevention, if you think about it in, you know, as it often is in social work. So the stories that we use to explain and justify these things are extremely important. Coming to the conclusion of this talk, just for me to suggest some ways ahead that are just based on the evidence that we've accumulated so far and these particular pieces of research. There will be many other equally viable ways of thinking about these things. So the work that we've done on the social gradient of referral, the fact that there are these inequalities built into the work that comes into the child welfare system right from the start, suggests that to reduce inequalities, you do need to put resources, money and expertise back into communities. So some of that work and some of the social workers need to come out of the walled fortresses in the middle of these local authorities with security gates and passes and photos of your face when you get in the building and go into a lift where you have to show your pass to go up a floor. None of that is preventative in the sense that it's taking people away from the communities in which these issues are. And what we've also done over the last 10 years is take away the people that were working in those communities who you could talk to and understand better what's happening on this street or on this estate or in that neighbourhood. So we need to put people with the skills back in there to help us. And specifically what we need is what I call problem-based intervention, in the sense that we're used to working with children and families on an individual basis. You know, in that sense, you target children to work with, families to work with. It's target problems to work with, not the individual needs, but what the underlying drivers of those needs. Every local authority will have its own local context of its own clusters of child welfare problems, which may be geographical or they may be thematic, in the sense there may be particular clusters of domestic violence and alcohol misuse in particular areas. Neglect itself looks different in different places. And the work that we've done looking at the factors recorded by social workers when they do assessments, we've found that demand is predictable in the sense that there are types of categories of demand that are consistent across different local authorities. We have the data to actually get at those categories, those types of demand, and profile them in terms of who the children are in terms of age, deprivation, the neighbourhoods, the geography of demand, and the presenting needs that are associated with that. We can use that data to develop strategies. And I think there's a particular need to do that with neglect. We already do this with problems that are familiar to us, such as child sexual exploitation, child criminal exploitation, county lines drug running. It's accepted that these are knotty clusters of problems that require a strategic approach. I think it's the same for neglect. Arguably the core problem of child welfare. Most child protection plans are for either neglect or emotional abuse. It cannot just be done on a case-by-case basis. We have the data that we can make better use of. And as an example of that, the work we did at Children's Social Care Systems revealed this distinctive picture in rural areas. If you imagine affluent rural counties, for example, with these pockets of deprivation, where families were very isolated, where the children's centres nearby have been shut, where there's a lot of social inequality and stigma around poverty, and those families find it really hard to access the support and the help they need. And there's a lot of child protection interventions therefore going on in those pockets of deprivation, and very hard for, if I imagine those counties whose budgets have been hit like everyone else's, to develop an effective network of preventative support over such a large area where you've got these pockets of deprivation here and there. That looks so, neglect in these areas looks very different from, say, in a very densely populated urban environment where you have you have estates with lots of social problems, but you have a completely different logistical issues around availability and the resourcing of services that families can get to, for example. So I know that rural poverty receives very little attention in this country, but it should get more, if only because it signals something about the strategies that we need. Nowadays, local authorities, I think, pretty much everyone has their own practice model, and they vary across different local authorities. They're trying to establish consistent approaches for social work practice. It can only be a good thing, of course, and that includes more emphasis in some places on awareness of poverty. BASWA produced quite helpful guidance on anti-poverty practice, and this is something that's incredibly important at the moment. Nonetheless, I would argue that training in these practice models is extremely beneficial, but there's only so much that it can do to address inequalities, as long as the underlying structure and systems remain the same or are pretty similar. So you've got to help social workers actually be able to put into practice these principles and this guidance, and that requires a strategic approach. We can borrow ideas, as we always do, from other fields such as policing. You have this problem-oriented policing literature. You've got literature on regulations, such as the book by Malcolm Sparrow, where he identifies there are these clusters of problems that have a local manifestation that require multi-agency approach to deal with. And in children's social care, when I was a social worker, multi-agency working was often about, well, it was actually out of a macro level in terms of the planning of the safeguarding board, but more often than not, it was about casework. The team around the child, team around the family, the multi-agency working to try and develop a care plan and coordinate that care plan. But we need a similar approach, but for these clusters of problems. What are we going to do about the way what neglect looks like in our area? What would we need to do in these places How would we help these families to ensure that there's less neglect? And the data for that, as I've said, does exist. We could do more. I think we do desperately need more data on the socioeconomic circumstances of the families we work with, child welfare services, but there's still, with the information we have, we can do a lot more with, and use the local knowledge of practitioners and managers in these areas. And one of the things we found in our research was that if you ask social workers about demand in general for services in that area, they will talk about poverty, and they will talk about housing and demographics and crime and all those social factors. You give them a case vignette to talk about, they'll talk about the individual factors and the risk factors. And it seems as if poverty disappears. And I don't think that's the case. I think it's just more, well, this is my job, this is what I do. But the knowledge is there. The knowledge that's not being utilised at the moment is enormous, I think. And then finally, back to politics and framing. I wonder about this. Of course, the emphasis this week is on communication, collaboration, social workers finding out the information, having the time to critical analyse and reflect in order to make good decisions and identify the children that need help most. And that's of course true. But thriving families and flourishing communities also keep children safe. That is the fundamental case for me for more prevention, because that is how we can keep people safe. Not all children, because unfortunately you never keep all children safe. We can do our best, and investing in prevention, in preventative services is the key task, I think, for social policy over the next decade. So that is, I think that is me. That is my inaugural professorial lecture at an end. I want to thank you so much for listening. I've gone way over time, as is my prerogative.
Thank you very much, Rick. And I think we will now hear from Wilson, who's going to give us the vote of thanks.
Thank you so much, everybody. And I'm Wilson Malaya. I'm head of Department of Social Work and Social Care, where Professor Rick Hood currently works. On behalf of Kingston University and colleagues in the faculty, the school and the department, and everyone on this call altogether, and on my behalf, I want to extend a very hearty, warm vote of thanks to Professor Rick Hood for gracing us with his important work and sharing with us his findings and opinions. Professor Rick Hood is an outstanding colleague who makes us proud. And I can go on and tell you a lot about how we've worked together throughout time he's been in the department. But in his lecture, he's talked about his work on prevention, risk factors, and inequalities. And from his lecture, his ideas of proximal causes in his analysis of prevention versus needs assessment really stands out for me, particularly the innovative scope of analysis, the building up of his analysis on preventative zone, highlighting for me some very key challenges. And within here, he then went on to talk about the work on income-deprived families, and the link between income-deprived families and the chance of referral was really fascinating, just seeing how that is linked and how as services, it creates quite a lot of pressure for us. How he sees the link between inequalities and needs, and his ideas on rebalancing children's services, and also the strategies to intervene in their preventative zone. And I think designing what actually matters for families was actually key as well from his work that is presented in his lecture. He has advocated for resources and support required for families to thrive, starting by addressing the local manifestations where the local needs are really addressed. So I just want to thank you, Rick, for a very insightful lecture, and thank you for sharing your ideas. Thank you, Professor Rick Hood, for sharing your work and thoughts. And thank you to you all for attending this very inspiring lecture. Thank you.
Cheers, Wilson. Much appreciated. I think we were going to say we're going to keep it open for 10 minutes or something like that. I know.
Yeah, so I think we'll do that. And thanks again, Rick. There didn't seem to be many comments that I could see in the Q&A, but so I think we could just throw it open.
Hi, Ray. Thank you for coming.
Hi, Rick. I'm sorry I'm not there because I'm sure now's the point when we should be sharing some wine together. But anyway, absolutely brilliant. And can I just back up what was being said in the introduction by Wilson just now? And you are one of the most foremost UK professors of social work. You're a leading researcher, widely recognised in terms of your contribution and your competence. Just reflecting back, I mean, less than 10 years ago, you were a PhD student at university and at Royal Holloway. In less than 10 years, you've gone from being a PhD student to leading academic for social workers, speaking for social work across the UK. So many thanks and well done. Can I make a couple of comments, if like substantive, about the content of what you've been saying? And just to alert everybody, if you were to look at Community Care today, the magazine online, you will see the stuff from Zahawi, the Minister of State, Secretary of State for Education, where he's making the argument, and I'm just about to quote, it says, we have to make sure if there is any evidence, any inkling, any iota of harm to any child, that the child is taken away immediately. Well, goodness me, that really is a sensational statement, because what it means is the 52,000 children in England with child protection plans should be removed from their families immediately. The 200,000 plus children who are subject to child protection section 47 inquiries every year should be removed from their children at the point the inquiry starts, because that's a question of iota of harm, when we initiate the inquiry, should be removed from their families initially, immediately. It's an horrific resetting of what we're being asked to do by the Secretary of State. And what it essentially means is we go from early prevention to early protection. And early protection is going to mean hundreds of thousands of children, if this was acted upon, being removed from their families. And that really is a terrible position to be in. And I was just going to make one other comment, Rick, if I might, and that's about neglect, because if you look at the child protection statistics, I think 84% of child protection plans, the primary reason for that plan is because of concerns about neglect and emotional abuse. And those two categories tend to be used almost in the same way by local authorities. They're about, if you like, chronic concerns. And within those concerns, I think we have to break it down a bit more rather than just talking about neglect. So a pitch from me that I've made before, we have to think about what neglect actually means, because it requires different responses. One type of neglect is passive neglect, and colleagues at Kingston who were involved with me with the research on the Troubled Families Programme would have seen some families that were just worn down, ground down by poverty, and weren't getting up in the morning, getting their children to school, exhausted. Passive neglect. That requires one type of response, getting there in there and helping the family. Secondly, thinking about baby P before the men moved into the household. That was a mother who was just chaotic in terms of her parenting competence and homemaking skills. That's chaotic neglect, and that's a different type of neglect and requires a different type of response. Someone which is about setting boundaries and expectations for the mother or the parents. And the third type of neglect is deliberate neglect, where people go out of their way to really hurt children. And that's what we've seen this week in relation to Arthur. It's what we had with Daniel Parker. It's what happened with Victoria Climbié. And that requires an urgent response from the police as criminal activity, as much as from children's social services. So I think we have to be a bit more discriminating in terms of what neglect actually means, because it requires different responses based on different types. But what really comes through from your research, Rick, is the impact of deprivation on families. And until that is addressed, and this steamroller is going to run away from us.
Thanks, Ray. It's really, I'm not going to talk anymore because I've talked too much already, but yeah, I agree entirely. And I think, I mean, something I suggested talking to Paul Bywater about is whether, you know, what happens if you call for a national strategy on neglect, you know, and then, you know, his view is that it just gets shunted down the same kind of interventionist kind of path. I think he's probably right. And that's why the way we talk about neglect is so framed by this idea that you have to kind of act without understanding first, almost. Yes, we do miss you, Ray. James just said in the chat, we miss you. David, sorry, David, you had your hand up.
Yeah, it's okay. I just worked out how to unmute. Rick, I suppose I just wanted to make a slightly different point, because I thank you for your lecture. It was just wonderful as always. I suppose as a colleague, I find your work inspirational in terms of thinking about research and the role of research. And I suppose what I was just reflecting on was the importance of research as a form of social work practice, and that the work that you and others are doing is so fundamental in terms of challenging the orthodoxy. Without the research to challenge that, then nothing changes. So I think it's about recognizing the importance of the role of research and the different forms of research, use of data, and contributing as you have done recently in terms of literature reviews and such like. So I suppose I just wanted to acknowledge that as a colleague in the department, that the role of research is fundamental, that we recognize that and celebrate that, and hopefully contribute to that in some small way.
Thanks, David. I really appreciate it. And it reminds me, when I did my PhD, I was renewing my social work registration with the JSCC. And I think I'd done my PhD in that 3-year period, done my PhD and qualified as a practice educator. So I thought I was okay. They wrote back to me saying I hadn't supplied enough evidence of continuing professional development. so yeah, I'm not sure how much I had to find some forms to send them. I mean, I guess there's always a mountain of things to consider with these, with these kind of topics, and that's why it took me an hour to say what I thought would actually be a 20-minute lecture.
Well, it doesn't feel right that we're not celebrating with a nice glass of something afterwards, but that was a truly interesting and I think inspiring lecture today, Rick. And I think that for many people that are thinking about where they might want to get into research in some of these areas, it's also helped to shine a light on particular areas that could be taken further. So I'd like to thank you so much for everything, for your talk today. I'd like to thank everyone for coming as well. So thank you.